This is the community assessment for Wolfeboro, New Hampshire. Wolfeboro has its own census tract, 9561.00. Wolfeboro is a mostly forested area surrounded by multiple lakes and mountains. Wolfeboro has a population of 6,269 people. The median age of the population is 54.4 years old. The population is 96% white and mostly Christian. The median family income is $51,000. This assessment was done following the Precede-Proceed model. Precede-Proceed has two main parts, diagnosis and treatment. It is split into 8 phases. For this model, one starts with the desired outcome and works backwards to create intervention. Precede-Proceed is used to evaluate different factors that contribute to the problem. One principle of this theory is that health is not just physical well-being, but it is quality of life. It emphasizes community involvement to develop ownership of health. Lastly, it has self-monitoring built into the model design. For this assessment, the focus is mainly on the precede portion. Wolfeboro has lower rates of diabetes, kidney disease, liver disease, and chronic lower respiratory disease than the rest of the United States. Wolfeboro citizens can boast having fewer years of potential life lost than the average U.S. citizen. There are also low rates of inactivity, excessive drinking, sexually transmitted infections, teen births, and underweight babies compared to the U.S. average. There are very high rates of mammography screening. Citizens reported the greatest health needs of the community were substance abuse assistance, access to health insurance, and access to health care, as well as assistance with obesity. The leading causes of death are as followed: heart disease, cancer, chronic lower respiratory disease, accidents, stroke, Alzheimer's disease, diabetes, influenza and pneumonia, kidney disease, liver disease, suicide, and drug overdose. The top health concern is substance abuse. New Hampshire has the 3rd highest drug overdose mortality rate. Everyone in the community has been affected by drug addiction in some way or another. The lack of insurance in Wolfeboro is very high. Up to 13% of citizens do not have health insurance. It is a combination of accessibility and affordability. In Wolfeboro, 92% of adults live in poverty, and 15% of children live in poverty. Children in poverty are a huge concern because it influences their lives so drastically. Wolfeboro's huge elderly population creates a problem of resources. There is a lack of elderly care, outreach programs, and affordable housing for people over 65 years old. A large elderly population affects the economy as well. There is a lack of access to places to get physical exercise. Wolfeboro has traditionally had a low rate of obesity, but in the past few years it has been rising very quickly. The determinants of drug abuse are important to consider when identifying the problem. Genetic determinants, neurological structures, and stressful life events can all contribute to drug use. Individuals with certain mental disorders are more likely to have drug dependence issues. Social influence greatly impacts the likelihood of drug abuse. Individuals with friends, family, and community that condone drug use will be more likely to use drugs. Drug use is more common in rural areas, and opioid deaths are much more common among white people. Wolfeboro is mostly rural and white, so that helps explain the problem. There are a few resources for drug addicts to get help. There is one hospital in Wolfeboro that also services the surrounding areas. There are 2 treatment centers nearby, but only one detox center. The facilities lack the resources to help everyone. There is an inadequate police and ambulatory services in the area due to the spread out geographic nature of the area. There are a few substance prevention and early intervention services available to the public.